You've heard the saying 40 is a new 30? Not when it comes to fertility. And a new report shows a lot of women don't get it. They're delaying motherhood and expecting reproductive technology will just reverse the expiration date on their eggs. This report conducted at Yale School of Medicine, and this is what they say. We see patients upset after failing and having their own biological child after age 43. The reaction, what do you mean you can't help me? I'm healthy, I exercise, I cannot have my own baby? Well, check out these figures. This is from a 10-year period, basically, a 41% increase in women age 41 and over seeking in vitro fertilization for assisted reproductive technologies. I mean, that's huge. And the statement, no surprise to my next guest, fertility specialist, Dr. Mark Surrey of the Southern California Reproductive Center in Beverly Hills. You see this heartbreak all the time.
We sure do. Every day.
What do you want to say to women?
Well, you know, I think that what you're doing tonight is very helpful, first of all, to educate people, because the common issue being is that, you know, people in our society have been trained, if you will, to think that they can sort of reverse the aging process, which, you know, in a way you can by, you know, being healthy.
Well, we think we're young.
Sure.
Hey, I'm young, why not? I can have a baby. And we see celebrities doing it.
Well, you know, you don't know how they're doing it.
Exactly.
Because there are lots of technologies now that can be helpful. And one of them has to do with something called ovum donation. And this is
the
where...
egg donor.
Exactly.
You get a younger woman.
Right.
Who has healthy eggs.
Correct. Because the health of the pregnancy, the incidence of pregnancy, is directly related to the chronologic age of the egg that the woman is producing.
Is that a little bit of a secret, though? We see more mature women having these babies, but they're not always telling people or telling society that they used an egg donor.
That's perhaps true. So, you know, it's a very common phenomenon. It's a common technology. It works very, very well. But, you know, it's a process, as many are, that people have to evolve into. The average patient who is in their 40s wants to try something else first.
They want to try on their own first.
Sure they do. And you know, it's a process where occasionally it's successful, clearly. But if you look at statistics, there's a logarithmic decrease in fertility as we age chronologically, and this has to do with the genetic content of the embryo that's produced.
Right. Because you can carry the baby with the donor egg. You just don't produce any more eggs after a certain age.
Well, you know, it's not necessarily that you don't produce any eggs. It's the genetic content of the embryo that the egg produces when it's fertilized that is significantly different when a person is 44 compared to when they were 24. Okay,
let me ask you about this, because even the Yale report said women should really consider freezing their eggs.
You know, it's a technology now that has come of age. Now, what I mean by that is that the way in which we're able to cryopreserve ova, unfertilized eggs now, by a technology called vitrification. It's like a flash freeze, and it works much, much better than the technology that we used to use.
Okay, I'm almost out of time, but I want to ask you, at what age should women consider that?
You know, really any time after 32, 33, and they should do it under 40.
Okay, you heard it here. Dr. Mark Surrey, thank you so much for coming in, because I know you're a big advocate of letting women know, and it's almost, I wonder if it's almost like a crisis state that women are just not thinking about this in time.
Probably true.
All right, thank you, sir, for coming in.
Thank you.
Jeff, over to you.